Hi, I'm Paul.
Hi, I'm John.
Very good. Healthcare.gov is the subject today, and we are IT professionals. We'd like to talk about 4 areas today of the Healthcare.gov website. The first, we'll just quickly go over from a citizen's perspective what we might recommend you do or don't do, and then from a government contracting perspective what might be causing some of the problems.
Third, we'll talk about the nature of large IT projects, and then segue into a discussion of user experience design for healthcare.gov.
User experience design. That will be fun. Are you going to teach us what that is?
Sure. Shouldn't take more than 5 or 6 hours.
He's the guy that knows, but we'll try to keep it short. So, of the 4 things, the first thing is citizens. What do we recommend you do? If you're okay with your current healthcare policy, again, we're IT guys, so we're not healthcare guys, other than he knows healthcare systems very well. But if you're comfortable with your current healthcare policy and you're comfortable with how much you're paying for it, don't sweat it, don't do anything. When tax time comes, they'll just ask you to prove that you are covered. Don't mess with the online, the website. If you're unhappy with your current policy or you're okay with it, but you'd rather be spending less, if you would like to save some money, which I know I do, it's useful to you to get online, and you don't have to register now to just find out how much a policy might cost you. So if you see on the home page, you can do 4 things. You can either call somebody and they will work with you directly in filling out the application. The second thing you can do, the little monitor circle there, you can do it yourself. Just go through all the forms yourself. That's what I did. I had the opportunity of going through it maybe 4 or 5 times, and I guess that only took me 5 or so hours.
What a privilege.
The third option, let's see, there was 1, 2. The third option is you can just print out, see the little PDF diagram or little button? You can print out the application yourself, fill it out, mail it in. The postage stamp date will show the date that you did the application.
Really?
And so that's
great.
That's what they told me.
Somehow old technology still works. Isn't it great?
I have to tell you though, when I was done, so after the 5th time, right?
After the 5th time. God.
I was on the phone with the fellow. This was the second person I was on the phone with. And he assured me that it would work. I wanted to get him to convince me that it would work at the end of all the time with him, because I said I already went through it with another guy online at the call center. He assured me that it would definitely work. When we spent probably 45 to 50 minutes together, and he got to the last step, and just like when I got to the last step, it told him that his application, my application, was incomplete, and suggested that I just print out, you'll see some of this, that I just print out the PDF application.
I like that. You know, it's their system, but it's your problem. They don't fix it for you. You've got to fix it.
By then, I was so tired. I asked if they could just mail it to me. I was ready to quit for the day. And they said, oh, that's not a problem. And you could hear them working away, tippity-tap, and at the same time, I'm looking for it on the website. And I couldn't find it. And he tries to help me find it. We couldn't find where it could be printed out. It's there now. I think
that's a good indication of an unusable system.
Yes.
Good. Can't find it.
And finally he says,
one of 4 major options. You can't find it. Good.
Finally the guy says, again, he was very friendly. So you'll get it in the mail. And he says, you'll get it in the mail in about 21 days.
By way of China?
So
Myanmar and Ceylon, perhaps?
So there are a lot of issues, but the guys on the phone are very friendly, and be patient with them. Because they're friendly, they're doing their best.
Good.
The system problems are not theirs. So again, if you want to save some money, I recommend you get on, and you can get on, we'll show you here, you can get on and look at the section on what you could save or what it would cost you, and you can see the different policies, and you can even just see the name of the company and call those insurance companies and ask them if you can sign up directly with them. Don't have to do it through the government. You can sign up directly through them, but make sure you ask them if you'll get the same savings based upon your income, because that's the new thing. right? The government is saying if your income's down here and you have this many children, they do it. They take two attributes of yours: income and children. You have 7 children, right, John?
At least.
So the more children you have, the better discounts you can get, and the lower your income, the better discounts you can get. So it could be a lot of work, but you can save a lot of money.
Good advice.
Now, you had said something earlier about the government somebody canceling policies.
President Obama has taken heat lately for his promise that if you liked your health care insurance policy, they wouldn't cancel it. And yet, cancellations are happening.
That's right.
And now, congressmen on Capitol Hill are responding to this problem.
Right.
Can you fill us in what's happening here?
Oh, I certainly can. So technically he was right. They're not canceling any policies. The government isn't canceling any policies. The government has created a law, and if an insurance company has to adjust your policy in order to be within the law by January 1st, it's their choice. The government doesn't say cancel John's policy. The government's saying you need to be within the law January 1st. The amount of money that's covered is not part of the law. The laws are what illnesses, pre-existing conditions, those kinds of things. It's what's covered, not how much you're covered for. Now, apparently beforehand they may not have covered me for being pregnant, but if I get pregnant, they have to cover me now. Is that what you're
Excellent.
saying? I'm not sure how the
Let's
pregnancy
have some more babies.
thing works.
That'll reduce your costs even further.
But
That's it. Double team them. If you and your wife get pregnant at the same time, 4.5 months to a baby.
yeah, that's a good point. So those are all the options. Print it out and mail it in. Do it online electronically yourself. Do it online with the guy helping you over the phone, or a woman. Or there's another one, you can just go to your insurance company, or the insurance company is listed on the site, and ask them if you can apply directly through them. And again, make sure that you get the same discounts based upon your income level.
Is there a 5th option? Where you can find someone locally called an ACA navigator who can hold your hand and walk you through the process?
Yes, that's right. These are people who've been trained. They don't charge you anything. You can go to their office and they'll walk you through the process and the application so you understand everything. Now, getting closer to information technology, government contracting. What do we know about government contracting?
We know a lot about government contracting, and Paul is the expert here. I'll let him talk about it.
Well, to be honest, it's not surprising why there are so many problems, at least in our view, with government contracting, and in this case with Healthcare.gov.
Because the low bid won it, and
The low
bidders
bidders
the
won it,
results of that.
right? When you have your house built, do you always pick the lowest bidder?
No.
Come work on my kitchen, lowest bidder. In this case, it was what they call a lowest cost technically acceptable solicitation. Now, in government contracting, there's really not a sales process. If you want to do something for the government, you just create your own big document and send it back to them saying, here's why we think we can do it. Our guess is, in this case, what happened was the government said, we have this much time, here's what needs to be done, who can do it, and we want the lowest cost of people who we think are, companies who we think are technically able to do it.
And how much did they spend on this effort? Do you remember?
You were saying
$500 million or something?
You were saying it was
$400 million?
$500 million. These contractors, you can see them sitting at the table, like John and I. John, I think we can do this.
Okay.
Yeah, we can. let's bid on it. But they say it needs to be done by April 1st.
October 1st.
October 1st.
October 1st is not possible.
Why?
Well, we have to cut so many corners it wouldn't come out very well.
Well, what is integration testing, and what is end-to-end testing, and what's unit testing? Why do you need 3 testings? Don't you have to just test things once?
We'll just do 1 round of testing. That's the way to cut corners, I guess.
So we can get it done by April 1st then? Or October 1st?
October 1st? Well, yeah, maybe.
Yeah, well, we've got we might fail, but you know what? Somebody's going to bid on this.
Yeah.
Somebody's going to make $200 million.
It might as well be us.
And they'll probably fail. I don't mind failing as long as I make $200 million.
Well, so we'll send it a bid.
So it probably wasn't that sarcastic, but I'm sure that's what happened. So the system can be, the system seems to be potentially set up to fail. I'm not sure how to fix it, but that kind of thing happens in lots of projects that are done that way.
Third topic was large IT projects. Really big systems have a problem because when they run over schedule...
You just hire more people. I'm sorry.
Exactly, that's what you do. You hire more people.
Yeah.
Because then you got more hands to do the work. The trouble is there's Brooks' Law that gets in the way. Because adding programmers to a late software project makes that project even later.
But the government knows that, right? I mean, or is that that's a new concept that we've just come up with?
That came out about 40 years ago.
Oh. So these contractors didn't realize that. Oh, what did they...
Well, it was President Obama who decided, back around November 1, that he would find the best and brightest in Silicon Valley and send them in to help him fix the problem.
And even the best and brightest have to be brought up to speed.
Right.
So
And who's going to bring them up to speed?
the people that are supposed to be working hard at fixing things right now.
So the whole project gets later because everyone's delayed with the learning process.
So Brooks' Law, that was from 1978, I have written down here.
Thank you.
And the corollary is there's always some incremental person, maybe it's person number 3, maybe it's person number 5 or 8, who when you add them to the project, then that actually makes the project take longer. So what's the next subject?
We wanted to talk about user experience design, user-centered design. And there are several subtopics here. There are millions of people who've tried to use Healthcare.gov, but only to date about 30,000 who've successfully used the system to apply. So we want to talk about this from a user's perspective. And in this light, there are really 4 main areas to talk about. There's the good news, there's the bad news, there's a discussion about what should have been done from a user experience design perspective, and what to do now, given that we're in this situation today. So, if we take a look at the website today, it looks pretty good. It's got a nice flat design, very modern, very appealing, much like Windows 8. So that should be some of the good news.
Windows 8? Everybody loves Windows 8, right? I think.
Didn't get a good reception, so maybe that was a bad choice.
I'm getting used to it though. I'm beginning to learn the things that are really, I thought used to be dots or squares, just plain old squares. You can actually click on them. Took me a few weeks to realize that.
Yeah. There is that problem with the homepage of the website now.
Now that I know.
Things that are circles really are clickable. And they're not just decorations. So maybe that's a bad idea. Well, there is some more good news here.
Really?
For a long, complex process, where the end user does the task really only once, the best interface is a step-by-step wizard. And that's exactly what they have on Healthcare.gov. There's a step-by-step process for completing an application for health insurance and determining eligibility. Well, the trouble is, it's not done just once. It seems to take you 4, 5, 6 times.
It was nice to know where I was in the process.
Good.
Each time I went through the process.
Good.
Again and again.
Good. We're trying to find some good news here.
Yeah, please, good news.
So, feedback. Proper feedback is an important aspect of a usable system. And the feedback they use here is a busy indicator, a little circle that spins around saying, we're busy, we're processing something for you right now. Trouble is, there's a better indicator, which is a progress bar, which shows you your progress from 0% to 100% of completion. They didn't choose to do that.
That's true. Right.
Now the system does use consistently green buttons with white text to say this is an action button. And they have nice bold headings. They did that right. And whenever you make a mistake, there's red text saying here's a mistake, and they tell you what field you filled out improperly or you left blank. That's good. The trouble is, the presence of errors implies that the error prevention methods they should have used were not there. So it's kind of a mixed bag on that one. Now, the system does have online help. Did you see help at every stage of the game?
Yes, they had the ability for you to click.
So there is context-sensitive help at each stage of the game.
You can actually chat people as well. I guess it's the same people.
And clearly with this website, users need all the help they can get.
Right. Now there were several little things in the data entry that you and I noticed. Several things it just forgets. Right? I'd go back through it a second time and it would bring up and have me confirm. I guess it's confirm all of the things that I'd already entered. Well, some of the questions that were on radio buttons were not answered, although I answered them the last time. So I had to answer them again. And also the Social Security number. Remember that one? I would scream over there. Because each time I would have to confirm that I put in my correct Social Security number, they would show me my Social Security number, but only with asterisks, and the last 4 digits would be shown. And I was supposed to confirm that I had typed it incorrectly. And so since I didn't want to have to retype, I just said, okay, yeah, I'm sure that's correct. The last 4 digits are correct. So I click enter. And it would give me the error saying that asterisks are not valid in a Social Security number.
Yeah.
And so every time I'd have to re-enter the darn.
So in short, the system forgets what you put in the last time. Because a good memory is a good thing, not just for humans, but also for computers. We expect the system to remember our last answers and to show them to us again and retain them. This is going to be a real problem for those 250,000 people who tried to use Healthcare.gov, failed, and have now received emails from the government saying, we're better now, please come back. They're going to have the same problem. They're going to come back, they're going to see their incomplete application. It'll say, your application is incomplete, but it will have forgotten your Social Security number.
And they don't tell you why it was incomplete.
Forgotten all your radio buttons and checkbox answers. And it won't tell you what's missing.
You just go through it all again.
You have to go through it all again.
And I interrupt because it angered me so.
That's good. Get some color in your face.
Oh. But what should they be doing now? Clearly, no one sat down and watched a pure user, a citizen who knows nothing about it, try to go through the system before it went live. They would have found several things.
It would have been helpful if they had done more one-on-one user testing. Because
Do you think they did any?
my sense is that the site looks good, and the wording in general is clear, though not always. But you can design a system that looks good if response time is great, but we've got a system that's got really awful response time. It's very slow. And a system that forgets things. And my sense is that they did not do end-to-end user testing near the end of the process, just before October 1st. Because if they had, they would have caught all these problems and realized we can't do October 1. We would be torturing U.S. citizens. We'd be torturing all these American voters,
Right.
who would be furious at the polls.
Right.
And you notice that they scheduled it for release October 1 in an election year where the president's not up for re-election. If they'd done this a year ago, October 1 of 2012, we would have a different president in the office right now, I think.
Impeach! So there was that one other question, I think you alluded to it when you talked about that it must have been written by an IT guy. It wanted to know, what was it that...
Are you a U.S. citizen or a U.S. national?
And then your options were yes or no. I didn't know how to answer that. I thought I took the safest route and I said yes. No.
It was written by a computer programmer who's thinking in terms of Boolean values.
So you're saying they wanted us to say whether if we were indeed one of these many?
One or the other or both.
So I was confused.
Yeah, that is a good one.
What are some other major points you have? Or are we done?
Well, they should have and hopefully did follow a user-centered design process, wherein they use the tools and techniques of user experience design, contextual inquiry, interviews, iterative user testing, touching the user throughout the design process, even toward the end, from beginning to end. Because there's huge benefits to be had from that, not just for the users themselves, but less headaches for Secretary Sebelius. She'd be spending a lot less time up on Capitol Hill.
How should they prioritize what they need to fix? The first thing that was screamed about was the site can't handle a number of people, it crashes, it freezes, it doesn't do anything.
Well, if they've had millions of visitors and only 30,000 can get through, clearly there's a capacity problem there. They've got to fix that one. But as we've seen with you, it doesn't even work right when you get through it properly. So there's just a straight functionality problem they've got to get fixed as well. But some of that needs to be prioritized. And you can, if they're trying to fix a system, a live system, it's like fixing a flat tire on a car driving down the road today. You can do that and it's risky, but to reduce that risk, it's very worthwhile still to get end user feedback, to show the system to end users, make sure it works properly before they release it to millions of US voters.
Could they send a team of, I don't know, 20, 50, 100 user-centered design people who are used to observing people and sit with citizens at their computers and maybe with their little tablets next to them are constantly logging things that the users are having problems with, and then back at some central database where they're all prioritizing what to fix on the website, they're seeing live, so to speak, or at least the end of each day, ooh, wow, 80% of the people out there are running into this funny question about yes and no and getting confused over what the Boolean thing we were talking, or most people are running into this. That would help them prioritize. Is that even feasible?
You could do that, but sending out a team of experienced professionals in the field to do that would give you lots of great data, but it gets to be expensive. You don't need to have that many out there at once. Even a handful of end users being tested by one professional at a time gives you a lot of useful data.
So this has been fun. Are there any other things we want to point out?
Well, I'm thinking about the income issue. When you applied for
My income's none of
healthcare-
your business, pal.
Now, did it ask you about your income?
It did.
Some 12 different sources of income?
Oh my gosh. Yes. It felt like it was April again. I was doing my taxes. And so I understand that they need to know my income because they want to figure out how much of a discount I should get, how much the rest of you guys should be supplementing my health insurance based upon how much I earn. So that makes sense, but they asked me to categorize my income by job, capital gains, other business income. They had like 15 or so categories. And then when you were done with that, they wanted you to itemize your deductions.
God.
I thought, this is April. Can't they? I know technically they can, but they ought to be able to reach into the IRS and look at my stuff. Now, there's probably laws against that, but they should realize that that's what people expect. The average citizen out there, including me, thinks, why do I need to tell you now twice a year all that detail? So I was pretty frustrated.
Yes.
And do you think they really needed that? I guess if they were going to figure out how much of your money they needed to give to me.
It seems excessive. If you simply ask them, what's your income? What are your deductions? 2 pieces of data should be sufficient for them to calculate your eligibility.
And they're expecting you to be honest, I guess.
So I'm really impressed that you spent so much time on this website with the call center providing all these answers. Did you ever get frustrated with the process at all?
Oh no, no, absolutely not, because there were such good people. Now, one of the times it was so much fun for me. Maybe it was the third of the 5 times when I was doing it on my own. We'll end our piece here, just allowing you to listen to what joy I had when I had just finished filling out the application for maybe the 3rd time. Thank you for listening, and we look forward to hearing from you next time. This is Paul.
This is John.
Take care. Oh, 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 I got it. I got it. Oh my golly. Oh my golly. Oh my golly, it worked. How exciting. Return to login page. Okay.